Once you have an idea of what your most prominent symptoms are, you're ready to use another of Myndplan's resources. We call them guides because, as the name suggests, they help you to find what's most important in a world that you've yet to explore. We've prepared a whole library of them for you. Each is a standalone course that describes a common symptom cluster, or what practitioners often refer to as a clinical diagnosis. Each guide is structured the same way. There are 4 sections. In the first one, you'll get a brief video introduction. Then I'll walk you through a detailed description of the key parts that go into a diagnosis, how they present in the doctor's office or out in the community, and their prevalence in society. This section includes symptom screens and severity rating scales that you can fill out, complete with scoring instructions. We give you a downloadable PDF version of each one so that you can fill it in on your own. The next section in each guide covers causes. That's because in addition to accurately classifying your problem, you also need to know what's contributing to it, particularly if you want to choose the most appropriate and effective treatment. The content in this section of each guide draws from research into how your personality and the world you live in shapes who you are and how you're feeling, the possible role played by diet, nutrition, or exercise, the chemical underpinnings of thoughts and feelings, and evidence regarding any genetic predispositions. Plus, we've reviewed the latest imaging studies that lay out how the brain's interconnections work, so that we can map out the networks that distinguish one condition from another. We use our neurodynamic videos, slideshows, and images to illustrate these principles. As you work through these causes, we suggest that you rank them using the form we provide, since your opinion on this matters when it comes to selecting an effective treatment. Speaking of which, each guide also devotes a section to the most prominent treatment methods in current use. We've scoured the research to get the latest findings and summarize them in plain language. This section of each guide focuses on giving you objective, side-by-side comparisons of most treatments that have at least some research backing, without any hype or effort to bias your opinion. For each of the methods we discuss, we rate the current evidence. A thumbs down signifies ineffective methods whose risks outweigh the benefits. A certificate indicates that the method has very weak evidence, usually in the form of individual case studies or a few very small studies. A medal indicates that the method has modest evidence, meaning that there may be a few larger, well-controlled studies. However, there may still be some methodological weaknesses, or the positive effects may not be as strong as desired. A trophy indicates that the method has strong evidence in the form of several larger studies that included placebo control groups. Furthermore, at this level, the treatment effects are clinically significant, meaning that they're meaningful. A trophy cabinet indicates that the method has very strong evidence based on good quality research that's been repeated across studies. Often these are referred to as gold standard treatments. To help you keep track of all this, we provide rating scales so you can record your preferences as you work through the material. This can help to ensure that any plan you come up with is the best match to your own unique needs as well as the best evidence. That gets us to the final section common to every guide, building your path. This section reviews the key points covered in each guide, summarizing the best evidence, causes, and treatments, and encouraging you to think of what this means for your own path to recovery and self-improvement. Our hope is that this will inform your choice of treatment methods, which may include one or more of the resources in our toolkit.